Please check the IV rate. Mrs. Shapiro, this is a blood pressure cuff. It's just going to get a little tighter on your arm.
Her IV's infusing at 125 milliliters an hour.
Okay, thank you. Mrs. Shapiro, your lungs sound really clear. That's really good.
Okay, that's good, because I've had some pneumonia in the past, and I've been a little short of breath.
Okay. Well, I'm just going to listen to your heart right now. You can breathe normally. This is a pulse ox. It's going to stay right there on your finger. Mrs. Shapiro, I'm hearing a heart murmur. Have you always had that?
Yeah, I've had that for the last couple of years. My cardiologist let me know that I had it. He said not to worry about it.
Okay.
Brittany, Mrs. Shapiro had 2 stents placed in her right coronary artery a year ago.
Okay, thank you, Heather. Are you having any chest pain right now, Mrs. Shapiro?
It's not really pain. It's more like a heaviness, pressure in my chest.
I'll get another set of vital signs. Can you describe this pressure for me?
It's right in the middle of my chest. It kind of goes through my back and up my left arm.
Okay. On a scale of 1 to 10, 10 being the worst pain you've ever felt and 1 being very little, how would you rate it?
I'd say it's like a 3 right now.
Okay. Are you having any shortness of breath or nausea?
Yeah, it's really tight, and I'm kind of short of breath.
Okay, it's making it difficult to breathe.
Mrs. Shapiro, is this the same type of pain that brought you into the emergency department?
Yes, it's exactly like it was earlier. Only this is it was much worse earlier. This isn't quite as bad, but it's getting there.
She's in sinus tachycardia at 102. Her blood pressure is 136/95, and her pulse ox is 93%. I think we should put 2 liters of oxygen on her.
I'm going to call the lab and see if her cardiac isoenzymes are back.
Ms. Shapiro, we're just going to put some oxygen on you to help with your breathing.
Okay, that might help.
Hi, this is Heather. I'm taking care of Mrs. Shapiro. I was calling to see if her cardiac isoenzymes have come back yet.
It looks like she's got an order for some sublingual nitroglycerin tablets and also an order for
so her
morphine.
troponin I's are 2.2 and her CKMB is a 15. Okay, thank you.
I think we should start out with the nitroglycerin and then see where we are from there.
Her troponin I's came back as 2.2 and her CPKMB came back as 15. I think this is indicative of a myocardial infarction. Let's try to get a 12-lead EKG.
Mrs. Shapiro, we're going to get an EKG on you to see what your heart is doing. I'm going to give you 2 more liters of oxygen because your labs are showing that your heart may not be getting enough oxygen right now, okay?
Oh, this is all making me so nervous. I feel so bad. I'm getting kind of short of breath.
Okay, hopefully the 2 more liters of oxygen will help you. We're going to all stay right here with you, okay? We're not going to leave you.
Oh, but I'm so scared. I'm so scared.
Mrs. Shapiro, I've got a tablet for you that I want to make sure that you put underneath your tongue, all right?
Okay, what is it?
Nitroglycerin. It's going to help your it's going to help with your chest pain. It's going to help deliver oxygen better to your heart.
Nitroglycerin always gives me a headache.
That's a normal side effect, but if it gets too bad, just let us know because we can treat the headache. But right now, we really need to treat your your chest pressure, okay?
Okay. Still awful heavy, and I'm still not breathing very well. I'm very nervous.
I'm going to call Dr. Williams and tell her about the cardiac isoenzymes.
I think that's exactly the right thing to do. Let's start her on a nitroglycerin drip at 5 mics per minute. I want you to titrate that up until she's chest pain free, but make sure that you keep her systolic blood pressure greater than 100.
Okay, so let me repeat this back. You want to start a nitroglycerin drip at 5 micrograms per minute, titrate until she's chest pain free, and keep her systolic blood pressure above 100.
Right.
Okay, great. Thanks, Dr.
Thank you.
Dr. Williams wants us to start a nitroglycerin drip at 5 mics per minute.
Oh, I'm so nervous. Please help me. I can't take this anymore.
Okay, Mr. Shapiro, your medication now. You just got off the phone with your doctor, okay?
Oh, but I'm so nervous. My chest is still tight and I can't breathe well.
Okay, just take slow, deep breaths, okay?
I'm trying, but it's bad.
We're all going to stay right here. We're not going to leave you.
You guys are so good, but I feel so nervous and restless.